So thank you, Paul. Thanks, Richard, and the members of the AAKP for the invitation to speak today. So I wanted to tell you, I'm trying to get my bearings. Okay, so I wanted to tell you a little bit about an exciting initiative that we're launching that we're calling the Kidney Innovation Accelerator, or KidneyX. And the basic idea is we want to spur innovation broadly in the development of new therapies, of diagnostics, of prevention of kidney diseases broadly. And we're taking an effort that's a partnership at heart across sectors for this. So Dr. Starr, I think, told you the state of care and science fairly well, so I'm not going to go over that too much. And I'm basically going to start by saying the system for care is unsustainable right now. So $34 billion annually from Medicare goes to pay for end-stage renal disease care. It's the only diagnosis that's automatically covered by Medicare. As you all know, I'm sure, which, just think about that number for a minute. That's roughly the equivalent of the NIH research budget, right? That's about 7% of Medicare spending. It's about 1% of the entire federal budget on this one disease area. And the costs are rising because the number of patients crashing into end-stage renal disease is going up. And as Dr. Starr pointed out, the sort of state of care is not where we want it to be, right? So if you look at the number of the drugs that were approved by the FDA in the last decade or so in this space, there's a handful of them. Most of them are symptom management drugs, with one exception recently, where tolvaptan was approved to slow progression of PKD. There's not much out there. Compare this to cancer, oncology, right? Where in the last 3 years alone, there were 29 new drugs approved, right? So there's a difference in scale here. As I'm sure you all know, dialysis, when it was invented, is a life-saving measure, right? It was a medical breakthrough that saved people's lives. But it hasn't fundamentally changed in the decades since it was introduced. There have been many improvements, but fundamentally, it's the same. I do want to point out that I think there's a number of really great innovations that have happened over the years in terms of care, right? So we have the Medicare ESRD program, which I just mentioned, which laid the groundwork pretty much for dialysis to be available broadly to all patients. It's a highly distributed system of care, right? You can go to a dialysis clinic pretty much anywhere in the country. And, because of the number of symptom management drugs, the mortality rates have gone down over time, and costs actually have gone down per patient over time. That being said, I think we're all here because we all know that there's significant barriers to innovation in this space. And the way we've thought about this is sort of broken down into the following. So one is that there's not a lot of money out there. Whether you're talking about research dollars, investment dollars, corporate spending, there's just a dearth of capital out there for investments in this space. And even if there was money, there actually aren't too many investable companies or projects that could easily be advanced at this point, right? So there's this gap that exists. I'm not a nephrologist. I'm a nanotechnologist by background, but my nephrologist colleagues like Dr. Starr like to point out to me that the kidney is a highly complex organ, right? And so there's significant scientific gaps, as you saw earlier, that need to be figured out before we're going to advance a lot of new therapies. So that's important. It's also, and again, apologies to the nephrologists and the patients in the room, but it's a relatively unattractive field. If you're a physician, nephrology is not probably in your top list of specialties to go into. It's not an attractive field right now for research. And so that's one of the barriers, I think, to innovation, right? So if you think about innovation, this happens from people. You need smart people in the space thinking about a problem. And so that's a gap that we have to address as well. And there's little urgency here, right? So we've heard about the race to cure cancer. We hear about urgency to tackle heart disease, but we don't see that same dialogue on a national scale with kidney disease, with renal care. And I think that's another issue we have to address. And the last one, I think, is, to me, the most kind of interesting and one we have to address head on, I think, is this, what I call the good enough syndrome. So when dialysis was invented, it was a life-saving measure. In the decade since, we've developed an entire healthcare infrastructure around dialysis around the care that we have today, right? So whether it's payment, delivery, just the care in the system, we assume that dialysis is the technology that's going to be around forever. And I think that it has, in the unintended consequence of that has been that it's prevented us from imagining something better. This is a set of slides that I stole from Joe in the audience, but this gives you a sense of, I wanted to sort of put some color to some of the barriers. So this is the investment landscape from the venture community in this space. So on the right, you see year-by-year numbers for venture funding in healthcare, about $9 billion last year. On the left, you see it broken down. I don't know how well you can see it, but it's broken down by disease type. Unsurprisingly, oncology is at the top. What you don't see here is nephrology or renal care. If you look specifically in the device space, two things to point out. One is the total amount of money is significantly lower than what you see overall in healthcare, right? So there's a lot less money invested in devices. Again, though, look at the indications. You do not see kidney or renal in here. So this is not something that's on the radar of investors currently. And so I think in order to sort of tackle this broad barrier to innovation, we have to think about this as a multivariable problem that requires a multivariable solution. And I've sort of broken down into kind of three categories. So on the financial side, one of the things that's missing is sort of end-to-end capital, right? That can take promising projects from an early stage with a clear pathway all the way to commercialization. That currently does not exist, right? It is not clear where new tranches of money are going to come from to move projects forward. And to the extent that we can clarify that or make that easier for entrepreneurs to understand from the very beginning, I think that's going to help attract more entrepreneurs in this space. And I think the only way to do that is to share risk, right, across government, foundations, industry, right? There are places at early stage where it's just too risky for industry to come in, and this is where I think government has to step in, foundations have to step in, and there has to be this shared risk across the spectrum. The perception issue, I think, is fairly important too. Again, I think if we can find a way to create more attractive incentives for talent to get into this space, that's going to help the overall level and pace of innovation. And part of that is around conveying a sense of opportunity rather than hopelessness, right? People are attracted to opportunities and problems to be solved. And so just the way we frame it, I think, is going to be important. And really expanding our notion of what's possible, right? I think the way, in a previous life, I spent several years studying how innovation happens and how different fields merge together to drive new innovation. And one of the things that I always noticed is that it's always often started from imagination, right? If we demand innovation, if we demand something better, and we kind of imagine a future state that's different from the current state, that's the groundwork upon which we can do innovation. So I think expanding our notion of what's possible in this space will be important as well. From a policy angle, and this is where we come in as HHS, I think one of the things that's going to really benefit the space is to create clearer pathways through all of the regulatory and payment processes that, frankly, I don't think any single person understands the whole thing, including people at CMS and FDA. It's a complex process, and to the extent that we can clarify what that looks like for an entrepreneur early on, I think it's going to help, again, attract people into this space. So I'm going to do a crude representation of what it's like to be an entrepreneur generally in healthcare. And apologies to the entrepreneurs in the room if I get this a bit wrong. But So if you start with the idea, I guarantee you that one of the first things you're going to look for is a justification for why what you're doing has an important public health or healthcare need. And you're probably going to cite CDC or CMS data. And I'll mention why I'll mention later why I'm mentioning this. But and at some point, you're going to want money. You're going to probably seek money from government funders like the NIH. You're probably going to want to seek funding from private and venture funding. Some point, as you develop your widget and your product, you're going to want to discuss clinical trial requirements with FDA. You'll file submissions. You'll probably also look for joint venture partnerships, exits, that kind of thing from a business angle. And at some point, you're probably going to think, oh shit, somebody's got to pay for this if I'm going to commercialize it. And you're going to think about how is this going to be paid for from an insurer, right? You're going to look for CMS payment mechanisms. You're going to look for private insurance payment mechanisms. And there's sort of two problems with this, I think. One is that if you look at the bottom piece of this all falls in the umbrella of where I work, the U.S. Department of Health and Human Services, right? This is a stake that we play along the process. And secondly, this is a drawn-out long process where you sort of discover things you have to do along the way, right? It's kind of a messy, disjointed process. So let me describe to you a sort of a better, more idealized journey from an entrepreneur, is that rather than thinking about all those pieces along the way, could we, as HHS, provide more clarity upfront to entrepreneurs where they understand, they understand, the public health need, obviously, but have easier access to non-dilutive capital upfront, understand future clinical trial requirements that will help them help you and other entrepreneurs design the widget that is going to meet those needs later on. I think there's an opportunity to also sort of utilize roadmaps and collaborations upfront, right? Let me skip this so that's sort of the basis, and I'll describe it a little bit later, but this is sort of the basis upon which we're thinking about KidneyX and how, we as a department, I think, could better serve the entrepreneur community to help advance new products. Like I said, our mission here is to accelerate innovation in the prevention, diagnosis, and treatment of kidney diseases. So let me spend a little bit of time talking about how KidneyX is going to work. So first and foremost, it's a partnership with the American Society of Nephrology. We have come together for a couple of reasons. One is that, like I said, we bring a lot of the components of what it takes to bring products to market to the table, right? We're a funder, we're a market regulator, we're a payer, we're also a public health steward, right? ASN is a community that brings a lot of broad expertise, and they've committed $25 million to this partnership. I won't go into this, but we're in the process of sort of formalizing this structure with them. But the way KidneyX is going to work is it's going to do essentially two things that'll lead to 3 and 4. So one is we want to offer a series of funding opportunities through prizes that are each targeted at a specific unmet need. So the reason why we are looking to prizes is that it's a non-traditional funding mechanism at government. We don't often use it, although there's a resurgence in the use of these. And there's a couple things. So one is that they're lower barrier to entry. They allow us to fund individuals from broad areas who aren't necessarily experts in this space. So it allows us to look to innovators in other fields who may have proven something. So they're low barrier to entry, they're exciting, they're paid for success. They allow us to shine a spotlight on a problem and get people excited about it. So that's one, and I'll talk about the first prize in a minute. The second is it allows us we're going to improve coordination across HHS, again, to serve the community of innovators and give them as easy of a path as possible and avoid unnecessary barriers. So we're working very closely with folks at NIH, CDC, CMS, FDA, CDC, to try to clarify to the extent that we can these commercialization paths that'll essentially provide access to patients for new therapies. And I think if we do 1 and 2 right, the goal really is to de-risk commercialization. We want to unlock investment capital. We want to get the private industry excited and in a place where they feel like they can step in. Again, to encourage more shots on goal, because I think if we're going to develop new therapies, we need a lot of ideas brought to the table. We need an environment where they can be tested, advanced, and so that ultimately, we have a better chance of creating better products. And I think if we do 1, 2, and 3 right, we're going to try. We're going to create a sense of urgency that doesn't exist right now. Again, to drive more interest and capital in this space. I won't go into this, but I just want to hit on the first one. One of the principles of KidneyX is that we want to be patient-driven, not just patient-centric, but patient-driven. We want to ensure that all product development keeps patients in mind, but also uses and works with patients as innovators themselves. There's a general philosophy that, we develop a widget and then we go and ask people whether they like the widget or not. We kind of want to flip that around and say, and work, co-create with patients, with clinicians, with all the people that have a stake in this, co-create widgets at the front end so we're not wasting our time creating widgets that nobody wants. The general formula of prizes, so we want to launch these prizes. We want to create environments within each prize where collaboration could happen. We want teams to work together. We want people from different fields of expertise sharing their expertise, thinking about new ideas together. We also, along with each prize, want to provide roadmaps that make it easier to take the ideas and the early stage development from the prizes forward, right? So along with each prize, we're going to have guidance that provides clear regulatory coverage and payment pathways. Let me see. Okay. So I'll do 3 slides. So there was a recent survey conducted by the Dialysis Patient Citizens that they do every year, and they included 2 questions related to KidneyX that I wanted to share. So one is there was a question asked about conditions that dialysis patients would most like to see addressed. So interestingly enough, so if you look in the middle somewhere is where you see mortality, right? This is the thing that clinicians often most care about and our system most often cares about, but it's somewhere in the middle here. What you see on the top is you see, and I'm sure it's not surprising to any of you, you see things like fatigue, low energy, the lack of ability to travel. I'm pointing this out because I think what we have to do with KidneyX and what we're doing with KidneyX is keeping patient preferences in mind and embedding them in the way we're trying to develop new products. And it's not just about clinical outcomes. It's about patient preferences and what you guys want. The second question is products you would most like to see developed. So right at the top of that list is next generation renal replacement therapy, things like wearable implantable dialyzers, which validates our thinking because the first focus of our prize is going to be to think about how to redesign dialysis. In fact, that's the title of our prize. It's called Redesign Dialysis. So this is going to be the first KidneyX prize. It's actually going to be announced today. But the goal is we're going to challenge the community to fundamentally rethink how we can deliver renal replacement therapy. We're working very closely with another project from the Kidney Health Initiative, which is a public-private partnership between ASN and FDA, that are developing a roadmap for developing alternatives to dialysis, to new renal replacement therapies. And that's going to be actually the basis topically of this prize. So the gaps that are outlined in that roadmap, and I won't go into it, are the subject of what we want to see in this Redesigned Dialysis Prize. And it's going to be broken down into 2 phases. So there's going to be a design phase that's going to launch later in October. The plan is to select up to 15 teams that will be awarded $75,000 each. There will be a second phase that will also be open to the public where we're going to ask teams to develop prototypes, early stage initial prototypes, with awards up to 3 teams for $500,000 each. Again, this is a goal the goal of this is to catalyze new thinking in this space. We want to bring in smart people from different spaces who haven't really thought about this as a problem to be solved, because they likely have ideas that really benefit this community. And so we're thinking very broadly in terms of the kinds of people we want to invite to participate here. This is the first of many prizes to come, just to note. The partnership with ASN is the first of many partnerships that we want to create as part of KidneyX. We're looking for a lot of different sort of components here. We want to work very closely with the investor community so that we're positioning KidneyX to serve and to align with how investors are thinking about investments and meet them, kind of do the proper handoff, right? We want to advance projects that are promising that can be picked up by the private sector. So we want to think about how we can create partnerships that will do that. I think if we're going to do this, we're going to need more than what we have in terms of prize money as well. And so, I think the work with ASN is the beginning, but I want to lay that as a foundation for future partnerships. I won't go into the rest, but the last one is important for you all. We need advocates. We need for people to know what we're trying to do here, and we need your help to raise this issue in your communities. Let people know, what we're trying to do, but we also want to hear from you so that we're positioning this to benefit the patient community in the end of the day. So, we need to work very closely with folks there. So I hope I'm not too much over, but thank you very much.